Hello everyone, today we are going to start day 2 of our Lippincott series and today we will do some more questions. So let's start with the question number 51. The nurse is reviewing a pregnant client's immunization record. Which immunizations are contraindicated during pregnancy and are not updated at this time? It's a SATA question and you have to select more than one option. So what can be the right answer? So answer number 2, 3 and 4 and 5 are correct answer because these are viral immunization जो कि pregnancy के time पर contraindicated होते हैं. Now let's discuss the question number 52. A 34-year-old multi-paris client at 16-week gestation who received regular parental care for all of her previous pregnancies tells the nurse that she has already felt the baby move. How does the nurse interpret these findings? So you have four options and let me know the right answer. So what can be the right answer of this question? Read all the question carefully. Answer number 4 is correct. This is normal because the multiparous client can experience quickening between 14 to 20 week of gestation. So this is absolutely normal. Next question. A 17-year-old gravid client presents for the regularly scheduled 26-week parental visit. She appears swelled, is wearing ill-fitted clothes and does not make any eye contact with the nurse. Which item should the nurse discuss with the client? It's again a SATA question. So what can be the right answer? Answer number 1, 2, 3 and 4 will be the correct. We have to ask for intimate partner violence, substance abuse, any kind of depression, blood glucose screening in this case. Now question number 54. When performing Leopold's maneuvers, which action should the nurse ask the client to perform to ensure optimal comfort and accuracy? Choose the right answer. Answer number 2 will be the correct, amputating her bladder. Now next question. The nurse performed leopard maneuver and determined that the fetal position is right occiput anterior, that is ROA. Identify the area where the nurse should place the Doppler most easily hear the fetal sound for right occiput anterior. So where should the nurse put the Doppler? So this will be the correct position. Now next question. The nurse is assessing fetal positioning for 32-year-old client in her 8th month of pregnancy. As shown below, the fetus is in the position. So ये fetus की position है. So you have 4 option. तो ये कौन सी position है इन चारों में से? You can see this position and let me know the right answer. So answer number 2 will be the correct. This is left occipital anterior position. Now question number 57. Which statement by the nurse would most appropriate when responding to a primary gravid client who asks, what should I do about this brown discoloration across my nose and cheeks during the pregnancy? So you have 4 options. What is the best response by the nurse? Answer number 1 will be the correct. This usually disappears after the birth. Now 58th question. A 36-old primary gravid client at 22 weeks of gestation without any complication to date is being seen in clinic for a routine visit. Why does the nurse need to assess the client's fundal height? So, what can be the right answer of this question? Answer number 4 will be the correct to estimate the fetal growth. Now next question. After the nurse reviews the primary healthcare provider's explanation for amniocentesis with a multi-gravid client, which complication, if stated by the client, indicate that she needs more teaching about the procedure? So if we are talking about amniocentesis, तो इस कंडीशन के अंदर क्या चीज इनअप्रोप्रिएट है? Answer number 4 will be the correct, fetal organ malformation. Now 60th question. A prenatal client wants to begin a yoga-based exercise class to keep her healthy during the pregnancy. What information should the nurse include in the plan of care? It's again a starter question. Select all that apply. So what will be the right answers of this question? Answer number 1 will be the correct. Second, third and fourth is also correct. Drink plenty of water before, during and after any workout. Take precaution to prevent overheating. Avoid jerky and high impact motions. Modify any positioning that puts strain on the abdomen. So next question on the screen. A primary gravid client at 28 week of gestation tell the nurse that she and her husband wish to drive to visit relatives who live several hours away. Which recommendation by the nurse would be the best? So you have 4 options and let me know the right answer. So answer number 3 will be the correct. Taking the trip is okay if you stop every 1 to 2 hours and walking. Now question number 62. The nurse teaches the client who is 18 weeks pregnant about seat belt safety. Identify the area that indicates that the client understands where the lap position of the seat belt should be placed. So this is the picture. So where should the client place the seat belt? So it will be the correct positioning of placing the seat belt. Now 63rd third question. Which recommendation would the most helpful to suggest a primary gravid client at 37 week of gestation who has leg cramps? So here are your options. What can be the right answer of this question? Answer number 3 will be the correct. Strengthen the knees and flex the toes towards the chin. Next question. A nurse sees a pregnant woman showing sign of airway obstruction. When the nurse asks the woman if she needs help, the woman nods her head yes. Indicate the area where the nurse first should be placed to effectively administer thrust to clear the foreign body from the airway. So this is the position, this is the picture. So what would be the perfect placement? So this will be the correct positioning. Now next question. When performing Leopold's maneuvers on primary gravid client at 22 weeks of gestation, the nurse performed the first maneuver to accomplish which action? So again you have 4 options on the screen. Let me know the correct answer. Answer number 2 will be the correct. Determine what is in the fundus. Now next question 66. A primary gravid adolescent client at approximately 15 weeks of gestation is visiting the prenatal clinic to undergo maternal quad screening. Which information should the nurse include in teaching plan for this client? So you have 4 options on the screen. What can be the right answer? Answer number 4 will be the correct. Increased level of alpha fetoprotein are associated with neural tube defects. Now 67th question. Which statement best identifies the rationale for why the nurse reinforces the need for continued prenatal care throughout the pregnancy with an adolescent primary gravid? client. Again, you have four options on the screen. What can be the right answer of this question? Answer number one will be the correct. Pregnant adolescents are high risk of pregnancy-induced hypertension. Now question number 68. Which information would be included in teaching plan about pregnancy related breast changing for primary gravid client? So क्या क्या changes breast में हमको देखने को मिलेंगे primary gravida के अंदर? So you have four option and let me know the correct answer. Answer number third will be the correct. Colostrum is usually secreted by about the 16 week of gestation. Now next question. A primary gravid client at 32 week of gestation is enrolled in a breastfeeding class. Which statement indicate that the client understands the breastfeeding education? Select or let apply. So you have five options on the screen. What will be the correct answers? Answer number 2, 4 and 5 will be the correct. I can hold my baby several different ways during breastfeeding. If I breastfeed, my uterus will return to pre-pregnancy size quickly. I need to feed my baby when I see feeding cues are not on she is crying. Now next question, 17th question. When planning a class for primary gravid client about the common physiologic changes of the pregnancy, the nurse should include which information in the teaching plan? So what can be the right answer of this question? Read all the options carefully. Answer number 2 will be the correct. Cardiac output increases by 25% to 50% during pregnancy. Now next question on the screen, that is 71. When teaching a primary gravid client about the diagnostic test used in pregnancy, the nurse should include which information? Read the option carefully and let me know the right answer. Answer number 1 will be the correct. A fetal physiological profile involves assessments of breathing movements, body movements, tone, amniotic fluid volume, heart rate, activity. Now 72 question. A client asks why she feels so much variability in fetal activity each day. The nurse explained that fetal movement is affected by which factors? It's again a SAT question. You have to select more than one option. So what can be the right answer of this question? Read the option carefully. Answer number 1, 3, 4 and 5 will be the correct answer. Next question. The nurse teaches a primary gravid client how to do Kegel exercises. What does the nurse explain is the expected outcome of this exercise? We are talking about Kegel exercise. This is the easiest question. Strengthening the perineal muscles. By doing Kegel exercise, we can strengthen our perineal muscles. Next question 74. During a routine clinic visit, a 25-year-old multi-gravid client who initiated prenatal care at 10 weeks of gestation and is now in her third trimester states, I have been having strange dreams about the baby. Last week I dreamed he was covered with hairs. What should be the nurse tell the mother? You have four options. Read all the options carefully and let me know the correct answer. Answer number 4 will be the correct. It's not uncommon to have dreams about the baby, particularly the third trimester. Question number 75. A primary gravid client at 36 weeks of gestation tell the nurse that she has been experiencing zomnia for past 2 weeks. Which suggestion would be most helpful in this condition? So what can be the right answer? So answer number 1 will be the correct. Practice relaxation techniques before going to the bed or bedtime. Next question. Which client statement indicates a need for additional teaching about self-care during the pregnancy? You have 4 options and let me know the right answer. I should sit in a hot tub for 20 minutes to relax after working. Answer number 3 will be the correct. The pregnant client in birth preparation classes. So let's discuss another question. Question number 77. A new antenatal G64 POA1L4 client attends her first prenatal visit with her partner. The nurse is assessing the couple physiological response to the pregnancy, which findings requires the most immediate follow-up. So you have 4 findings. In which condition follow-up is required? Answer number 4 will be the correct. The father of the baby is irritated that the mother is not like as she was before the pregnancy. So this is the most concerning thing and we need follow up in this condition. Now question number 78. When preparing a prenatal class about endocrine changes that normally occur during pregnancy, the nurse should include information about which subject. Read all the options carefully. What can be the right answer? Answer number 4 will be the correct. The thyroid enlarged with an increase in basic metabolic rate. 79 question. When developing a series of parent classes on fetal development, the nurse should include which feature as being developed by the end of third month, 90 to 9 to 12 weeks. So what will be the correct answer? क्या डेवलप होता है बेबी के अंदर by the end of third month? So what will be the right answer of this question? Answer number 1 will be the correct, that is external genitalia. Now question number 80. During a 2-hour birth preparation class focusing on labor and birth process for primary gravid clients, the nurse is describing the maneuvers that the fetus goes through during the labor process when the head is at the presenting part. In which order do the maneuvers occur? All options must be used. So 1, 2, 3, 4, all are in sequence. So these are already in a sequence manner. Now 81 question. A primary gravid client in a preparation for parenting class asks how much blood is lost during an uncomplicated vaginal birth. What would be the nurse tell the client? So this is a good question. Answer number 1 will be the correct. The maximum blood loss considered with the normal limits ml. 82 question. Which statement by the primary gravid client about the amniotic fluid and sac indicates the need for further teaching? So what can be the right answer? So answer number 2 will be the correct answer. Fetal nutritions are provided by amniotic fluid, but in reality placenta provides nutrition to the fetus. Now 83 question. During the birth preparation classes, a primary gravid client at 36 week of gestation tell the nurse, my lower back has been really been bothering me lately. Which exercise would be most helpful? So what can be the correct answer? Answer number 1 will be the correct, that is pelvic rocking. Let's discuss the question number 84. A client is experiencing pain during the first stage of labor. What should the nurse instruct the client to do to manage her pain? It's again a starter question. You have to select more than one option. So what can be the correct answer? So answer number 1, 2 and 4 will be the correct. Walk in the hospital room, use slow chest breathing, lightly massage at the abdomen. Let's discuss the next question, that is 85. During a preparation for parenting classes, one of the participants asked the nurse, how will I know if I am really in the labor? What should be the nurse tell the participants about true labor contraction? So read all the question carefully and let me know the right answer. True labor contraction are felt first in the lower back, then abdomen. Answer number 4 will be the correct answer. Now next question. After instructing participants in a birth education class about the methods for coping with discomforts in the first stage of labor, the nurse determines that one of the pregnant clients needs further instruction when she says that she has been participating which technique? Read all the option and let me know the right answer. What can be the right answer of this option? Answer number 4 will be the correct. Pelvic tilt exercise, जो कि नहीं करने चाहिए. Now next question 87. After a preparation for parenting classes session, a pregnant client tells the nurse that she has had some yellow-gray 40 vaginal discharge and local itching. What will be the best advice for the client to the nurse? Schedule an appointment at clinic for examination. We have to examine what condition from she is suffering from. Answer number 2 will be the correct. Now next question 88. The topic of physiologic changes that occurs during the pregnancy is to be included in a parenting classes for primary gravid clients who are in the first half of pregnancy. Which topics would be most important for the nurse to include in teaching plan? So you have 4 options. Read all the options carefully and let me know the right answer. Answer number 2 will be the correct. Increased risk of UTIs. Let's read the next question. A multi-gravid client at 32 weeks of gestation has experienced hemolytic disease of newborn in previous pregnancy. The nurse should prepare the client for frequent antibody titer evaluation obtained from which source? Answer number 4 will be the correct, that is maternal blood. Now question number 90. Which diagnostic test should be the most important for a 40-year-old primary gravid client to have in second trimester of pregnancy? That is quad screening. Answer number 4 will be the correct. Let's discuss the question number 91. The nurse is caring for a client who has an history of gastric bypass surgery and is now being seen for her first parenteral visit. Which intervention should be included in plan of care? Select all that apply. So read all the options carefully. What can be the right answers of this question? So answer number 1 will be the correct, 2 and 5 will also correct. Take the prenatal vitamin with 400 mcg of folic acid. Refer the client to registered dietitian. Check urine at each visit for protein and glucose. Now next question. A client with past medical history of ventricular septal defect prepared in infancy is seen at prenatal clinic. She has dyspnea with excretion and is very tired. Her vitals and oxygen saturation 98, pulse 80, respiration 20, blood pressure 116 by 72 mmHg. She has plus 2 pedal edema and clear breath sounds. The nurse determined the client's symptoms indicate what? Which cardiac function classification जो कि इन symptoms के अंदर आती है? So what can be the right answer of this question? So answer number 2 will be the correct, that is class 2. Classification second. Now next question. A primary care client has completed her first prenatal visit and blood work. Her laboratory test for the hepatitis B surface antigen is positive. The nurse can advise the clients that the plan of care for this newborn will include which intervention, select all that apply. So इस क्वेश्चन में भी एक से ज़्यादा आपको आंसर देना है. So read the answers carefully and let me know the right answers. So first, second, and fifth will be the right answer. Hepatitis B immunoglobulin at birth, जो कि हमको देना चाहिए. Series of 3 hepatitis B vaccination as per recommended by the schedule. And fifth answer, that is universal precaution for the mother and infant will be applied. So next question. A mother with asthma control through the consistent use of medication is now pregnant for the first time. Which client statement concerning asthma during the pregnancy indicates the need for further instruction? So you have 4 options. Read all the options carefully. What can be the right answer? Answer number 4 will be the correct. Bronchodilators should be used only when necessary because the risk they prevent to the fetus. So now let's discuss the next question, that is 95. A woman at 22 weeks of gestation has right upper quadrant pain radiating to her back. She rates the pain at 9 on scale of 1 to 10 and she says that it occurred 2 times in last week for 4 hours at a time. She does not associate the pain with food. Which nursing measure is highest priority for this client? So pain level काफ़ी ज़्यादा है तो क्या priority होगी? You have 4 options. Read all the options and let me know the right answer. Answer number 2 will be the correct. Refer the client to HCP for evaluate treatment for the पेन, क्योंकि 9 पेन है 10 में से काफ़ी सीवियर पेन है पेशेंट को, तो हमको फिजिशियन को ये चीज़ बतानी है ताकि वो पेन का ट्रीटमेंट दे पेशेंट को. Let's discuss the next question. The client in the triage area who is at 19 week of gestation state that she has not felt her baby move in the past week. No fetal heart tones are found. While evaluating this client, the nurse identifies her as a being that highest risk of developing which problem? Read all the options and let me know the right answer. So किस condition में ऐसा हो सकता है? Answer number 3 will be the correct. Disseminated intravascular coagulation. Now let's read the 97th question. The nurse performed a routine prenatal assessment on a woman at 35 weeks gestation and finds vital signs. BP is 138 by 88 mmHg, pulse is 82 beats per minute, respiration is 18 beats per minute, and temperature is 99.1 degree Fahrenheit. Which statement is most appropriate for the nurse to make at this time? So read all the options. What do you think? What can be the right answer of this question? So what should we say? Answer number 2 will be the correct. Your blood pressure is slightly high. I will check it again before you leave. Now read the question number 98. A 40-year-old client at 8 weeks of gestation has a 3-year-old child with Down syndrome. The nurse is discussing amniocentesis and chorionic villus sampling at genetic screening methods for the expected baby. The nurse is confident that the teaching has been understood when the client makes which statement. So you have 4 statements by the client. So which will be the appropriate? Chorionic villus sampling can be performed earlier in pregnancy. Answer number 2 will be the correct answer. Now let's read the question number 99. After conducting a presentation to a group for adolescent parents on a topic of adolescent pregnancy. The nurse should determine that one of the parents needs further instruction when the parent says that the adolescents are at greater risk of which complication. So you have four options. So कौन से ऑप्शन से उनको फर्दर टीचिंग की रिक्वायरमेंट है? Read all the option and let me know the right answer. So answer number 4 will be the correct, that is congenital abnormality. This is irrelevant, so we have to teach the client further. So now last question, that is question number 100. A DNC is scheduled for a primary gravid client admitted to the hospital at 10 weeks of gestation with abdominal cramping, bright red vaginal spotting and passage of some of the products of conception. The nurse should assess the client further for expression of which finding. So you have four options. What can be the right answer? Choose the correct answer. So answer number 4 will be the correct, that is guilt. So it was all about today's class, and on third day of Lippincott series we will discuss further question.